On the 3-year anniversary of the CARES campus in Reno, we're comparing it with one of the most successful models in the country. It's in San Antonio, Texas, and it's called Haven for Hope.
Now, both facilities are funded by federal, state, and local agencies, and both unify area nonprofit groups to help reduce homelessness. But in this report, I'm pinpointing two differences. 91% of people who leave Haven for Hope in San Antonio, Texas, get into housing and remain there a year later. And 79% who leave don't return to any kind of homeless agency or service in the surrounding area of Bexar County 1 year later. While the CARES campus in Washoe County is boasting impressive results as well, it hasn't reached these levels yet, but there's good reason for that. Haven for Hope has been around 11 years longer.
We're really proud of the work that we're doing here, and that's why we invite other communities to come and check it out.
I found two major differences between the homeless support services in Texas and Northern Nevada. The first is the initial process of providing help.
If you can house the temporarily homeless, by themselves and away from the chronic homeless, this would encourage their movement through the process. The homeless that are just transiting through, if they're not subject to all of the stresses of the stealing that's going on, the problems that the chronic homeless bring, they will be able to focus
on getting a job, getting their life in order, and getting their permanent housing again. We brought his suggestion to Washoe County's Housing and Homeless Services Director, Dana Searcy. Are you currently doing that, separating the chronic homeless from the temporary homeless?
So we're not doing that specifically. When you first come to the campus, you move into the bunk bed dorms, very similar to what we are sitting in today. Each of those dorms is broken down into about 100 people.
To get a bed at the Low Barrier CARES campus in Washoe County, a person must be unhoused, 18 or older, and be able to independently complete their own daily activities. Here, they can receive many services, including access to one of 43 case managers and 6 licensed mental health counselors. If someone engages their case manager and is working toward a housing plan, they can eventually be moved into a semi-private space.
What we call the cubbies, those are little 8x8 units, a little more privacy.
In San Antonio's Haven for Hope, the homeless are assigned to either the congregate shelter or the dorm setting. The congregate shelter is for the chronic homeless and, as a result, provides fewer services.
It's more of our emergency shelter. It's called our South Campus, otherwise known as our courtyard. No ID required. You can still be active in your addiction, but you don't have to engage in services. It's available to you, but you opt into those services.
The dorm setting, also called the transformational side, is for the temporary homeless, so it provides more services and privacy and support from the very beginning.
You do have to have an ID, have been a Bexar County resident for at least 9 months in your life, and you also have to commit, similar to what you have at your program, commit to some sort of a housing and income plan where you're actively working on those plans to transform your life and get into stable housing.
These individuals qualify for behavioral and substance abuse support provided by the Center for Healthcare Services, mental health services provided by the county mental health provider, and support from 70 other nonprofit agencies. And for the homeless working to pay for a deposit or down payment,
we have a YMCA on our campus that provides free child care for our clients, but also for the community. 3
other partner agencies provide medical, dental, and vision services to the homeless, but also to the community as a whole. Haven for Hope is located in the poorest zip code in San Antonio. All of these incentives provide motivation to get to this transformational side of the campus. The second major difference is the way each campus is run.
When we initially opened, we had a number of partners located on our facility that were doing the work. So Haven for Hope staff were really more of the administrators. Through the years, our staff has grown to where we now have more than 300 staff members doing everything from security in our life safety department to campus life, the navigators who are working with our clients day in and day out to provide their needs.
Haven for Hope's more direct involvement allows it to more quickly adjust programming and services based on the ever-changing needs of its homeless population. Today, Haven for Hope partners with 70 agencies. 20 have office space in this facility. This staffing shift also gives its nonprofit partners more flexibility responsibility to provide services in the community to help the people who exit. The CARES campus in Reno is more like Haven for Hope was when it was also 3 years old.
We have about 30 staff on site that are Washoe County staff. That includes a couple of operations managers, all of the case managers, and 6 behavioral health counselors. We also have major contractors on site. Again, Allied has about 20 staff here, 6 full-time, round-the-clock security. Volunteers of America has about 115 staff on site, and Karma Box has 8 or 9.
The two biggest differences, Haven for Hope in San Antonio immediately separates the chronic homeless from the temporary homeless and is directly responsible for the majority of staff working in its campus. And Haven for Hope in San Antonio is on 22 acres and serves a population of about 2 million people. The Nevada Cares campus in Reno sits on 15 acres and serves a population of about 500,000 people. Tomorrow in this 5 o'clock newscast, we're highlighting the life of a local man who is now homeless, the little decisions that eventually led to his struggle on the streets.